Welcome to the Family Health Debrief, a podcast where healthcare workers explore crucial topics that impact our practice and the families we serve. Today, nursing students May, Ellie, and Nate will guide us through the social determinants of health, more specifically, education, location, and income, and the far-reaching impacts on family health. Let's dive in with insights, real-world examples, and essential statistics to understand these factors better. Education is one of the most powerful predictors of family health. May, why don't you kick things off by sharing how education shapes family health outcomes?
Absolutely. Education significantly shapes family health outcomes by influencing health literacy, access to resources, and overall decision making about health behaviors. And this aligns with the studies of Journal of Pediatrics and Child Health. Think about it. Educated parents not only gain better employment opportunities, but also have greater awareness of healthy lifestyle choices because they are often more informed about health risk, prevention strategies, and treatment options. According to Statistics Canada, individuals with a post-secondary degree are more likely to report excellent or very good health, with studies showing a 20% greater likelihood compared to those without higher education. And in addition, studies found by diabetes care, individuals with lower levels of education are linked to an increased risk of chronic health issues, including high blood pressures, diabetes, and obesity.
That's very compelling, May. Now maybe we could insert some kind of real-life or clinical example just to help drive home our points.
Sure, I once worked with two families managing diabetes, each with a different educational background. The first family had parents who were college educated and had researched diabetes extensively. They were proactive about meal planning, regularly monitored blood sugar levels, and followed up with healthcare appointments. And these allowed them to manage the condition well, reducing the risk of complications of their child with diabetes. The second family, with a more limited educational background, struggled with health literacy and understanding the importance of blood sugar control. They struggled to consistently follow the prescribed medication routine and the dietary modification and know when to ask help. As a result, their child experienced more frequent hospitalization due to poorly managed blood glucose levels.
That's really great insight, May. Education clearly creates a ripple effect on the well-being of families. Thank you, May. Now, Ellie, let's talk about how families' location influences their health. What sort of things did you find?
Location is incredibly influential. Families in urban areas generally have easier access to healthcare services, education, and job opportunities. But these areas also bring challenges like high housing costs and environmental pollutants. Meanwhile, rural families can struggle with limited access to healthcare, leading to disparities in health outcomes. Statistics Canada found that rural residents reported 15% higher rates of chronic conditions like diabetes and arthritis than those in urban settings.
That's a major difference. Do you have an example from practice to show how location directly may affect a family's health?
Definitely. I worked with a family in a remote area who relied on a small community clinic that opened only 2 days a week. The lack of regular healthcare access worsened the father's untreated hypertension, leading to a stroke. Had he lived closer to a full-service hospital, early intervention could have prevented this outcome. Stories like these remind us that a family's zip code can be a major predictor of their health.
Great points, Ellie. In addition to your insights, Child and Family Health Services play an integral role in supporting and responding to children and families with complex physical, developmental, psychosocial, and behavioral medical issues. According to a recently published article by Stockton et al., Family Health Services work collaboratively with parents to support positive child development, perinatal mental health outcomes, and positive parent-to-child relationships, but these are not easily accessed by families living in rural populations. There's rural health data collected from a medical journal, also published in 2022 by Stockton et al., that indicates that poorer health behaviors and outcomes for families in rural and remote areas includes lower breastfeeding rates, low birth weights of infants, and high or very high rates of psychological distress. This is an unfortunate reality that the World Health Organization has stated requires significant reduction. Now, Nate, tell us about how income levels or socioeconomic status can impact family health.
Income is foundational. Higher income families can afford quality food, secure housing, and health care, whereas families with limited resources often face barriers that negatively affect their health. Statistics Canada reports that individuals in the lowest income quintile experience chronic conditions 30% more frequently than those in the highest quintile. Income disparities can often create health inequities that perpetuate across generations.
That is a staggering statistic, Nate. Can you give us a clinical example of how income affects family health? Perhaps draw from your own clinical practice and let us know. Have you ever had a patient who was negatively affected by their socioeconomic status?
Certainly. I recently cared for a patient admitted with complications from diabetes. It's a condition that disproportionately affects low-income individuals. This patient faced challenges in managing their health due to limited access to nutritious food and healthcare resources. But by connecting them with community programs that provide affordable, healthy food options and offering education on diabetes management, we were able to help them improve their health outcomes. This approach aligns with findings from a study published in the Canadian Journal of Diabetes, which emphasizes the importance of addressing socioeconomic factors in diabetes care to reduce health disparities. You can find more of this information at www.canadianjournalofdiabetes.com, or I can post a link to the article for your viewers to read.
It's really become clear that income isn't just a financial issue, but also a health issue, affecting each part of a family's mental, physical, and spiritual wellness. Thank you so much, May, Ellie, and Nate, for such a thorough and eye-opening look at how education, location, and income or socioeconomic status can impact family health. As healthcare professionals, understanding these determinants helps us advocate more effectively for the families in which we serve. Stay tuned for more insights and conversations here on Family Health Debrief. Let's work together to create healthier futures for our community.